major zoonotic diseases that have impact on sheep and goats. We are talking about the zoonotic diseases. Historically, zoonotic diseases has a tremendous impact on the evolution of man, especially those cultures and societies that domesticated and bred animals for the food and clothing. The word zoonosis has introduced by the Rudolf Virchow in 1880 to include the collectivity, the diseases shared in the nature by man and animals. More than 60% of the human pathogens are zoonotic. We all know that. So the World Health Organization in 1959 has defined the term zoonotic diseases as those diseases are infectious which are naturally transmitted between the vertebrate animal and infections that are shared between the vertebrates and males are known as the zoonotic diseases. Every year, World Zoonotic Day is organized on 6th of July, which commemorates the work of the French biologist Louis Pasteur, who successfully administered the first vaccine against the rabies in 1885. There are many zoonotic diseases which occurs in the sheep and goats. When we're talking about the classification of the zoonotic diseases, first we talk about the mode of transmission. The classification according to the mode of transmission, we can divide it or we can divide it into the 4 types. First is the direct zoonosis. These are transmitted from an infected vertebrate host to a susceptible host by the direct contact or by the contact with the fomite or by the mechanical vectors. Diseases like the rabies, anthrax, brucellosis, and leptospirosis are the example for the direct zoonosis. Cyclozoonosis, these require more than one vertebrate host species, but no invertebrate host for the completion of the life cycle of the agents. Examples are echinococcosis and teniasis. Metazoonosis, these are the transmitted biologically by the invertebrate vectors in which the agents multiply or develop, and there is always an extensive incubation period before transmission to another vertebrate host. Examples of these diseases like the plague, schistosomiasis, and leishmaniasis. Saprogenosis, these requires a vertebrate host and a non-animal development site like soil, plant material, pigeons, etc. for the development of the infectious agents. Example for this is the aspergillosis, coccidioidomycosis, and histoplasmosis. Another classification according to the reservoir host, first is the anthropogenosis, that the infection transmitted to men from the animals like rabies, leptospirosis, plague, brucellosis, and Q fever. Anthropogenosis, infection transmitted to man from the animal. Zooanthropogenosis, that is the infections transmitted from man to the animal. And amphiensis, that is the infections maintained in the both man and the lower vertebrate animals and transmitted in that either direction. Now, classification according to the cause. There are some etiological agents. According there, we can classify the zoonotic diseases. In concern of the sheep and goat, bacterial zoonosis. The example of the bacterial zoonosis that is caused by the bacteria are anthrax, brucellosis, leptospirosis, paratuberculosis, and listeriosis. Viral zoonosis, that example are the ORF, vesicular stomatitis, Rift Valley fever, and FMD. In the rickettsial zoonosis, the example is Q fever, protozoal zoonosis, that is the toxoplasmosis, helminthic zoonosis, the echinococcosis, and fungal zoonosis, that is the histoplasmosis or ringworm, example for this. Now, this is the transmission in humans by the source, that is through the sheep and goat. We can say it is by the direct or by the indirect contact. By the direct contact, that is biting, by the scratching, and by the indirect contact, that is by the indirect transmission, that is through the ingestion, inhalation, or inoculation of the infective agents. Zoonotic disease that is transmitted by the contact. It may be the direct contact or the indirect contact. These are the rabies, contagious ecthyma, vesicular stomatitis, anthrax, brucellosis, leptospirosis, campylobacteriosis, listeriosis, salmonellosis, Q fever, caseous lymphadenitis, scabies, and ringworm. These are transmitted by the direct or indirect contact. Now, these are the diseases we transmitted through the eating of infected mutton and chicken, that is the half-cooked or partial cooked or raw mutton or eaten, that is the chicken eating, cause this disease. There are the anthrax, sarcocytosis, there is the toxoplasmosis, paratuberculosis, that is Jones disease, salmonellosis, listeriosis, and campylobacteriosis. Some of the diseases that is transmitted through the drinking of contaminated sheep and goat milk. That is brucellosis, listeriosis, salmonellosis, Q fever, campylobacteriosis, and paratuberculosis. Some diseases which transmitted through the inhalation, that is the anthrax and Q fever. Now, the main zoonotic diseases, we start from the anthrax, also known as the splenic fever, white powder disease, malignant pustular dermatitis, and wool shotters disease. This is caused by the bacteria, that is the Bacillus anthracis. It is a spore-forming, gram-positive, aerobic and non-motile rod-like bacteria. Spores occur on exposure to air and are highly resistant. The spores of the bacteria are highly resistant, can survive in the environment, soil, water, and vegetation for the several years. When we're talking about the animal transmission through the breathing of the anthrax spores or by the biting flies, this disease can transmit it from one to another animal. So we are talking about the transmission in humans, handling infected animals, carcass and products. Eating undercooked contaminated meat from the infected animal can infect the humans. It can be transmitted by the biting flies like Stomachs, tabanus, and other insects, but they act as a mechanical vectors. It can also occur by the inhalation anthrax spores, causing wool shotters disease in handlers. In the humans, that can get transmission from the cutaneously by the biting flies, by the ingestion, by the inhalation of the spores, and cutaneously contact with the spores. Animal symptoms occurs in peracute and acute form. In peracute form, symptoms are similar to cattle. Sudden death by the staggering gaits, trembling of the body, grinding of the teeth, and labored breathing. In some animals, tremors, dyspnea, and congestion of the mucosa are seen. And within 1 to 2 hours, convulsions and death are recorded. In the acute form, symptoms are high fever, lack of rumination, hemorrhages on the mucosae, excitement followed by the depression, incoordination movement, and convulsions. Bloody discharge from the nose, mouth, and rectum, swelling in the different body parts, sudden death, or incomplete stuffing after death. When we're talking about the human symptoms, the chief complaint in the main are the formation of malignant carbuncles and pneumonia. Cutaneous form is the main manifestation in man. There is occur in the three form. First is the cutaneous form. Cutaneous anthrax is also known as the white powder disease. Is when anthrax occurs on the skin. It is the most common form. Is having cases the more than 90%. It is the least dangerous form, and cutaneous anthrax present as a boil-like skin lesions that eventually forms an ulcer with the black center, also known as a issue. Next one is the gastrointestinal form in humans that is manifested by the fever, nausea, bloody diarrhea, loss of appetite, and stomach pain, occasionally vomiting of blood. In the respiratory forms, fever, chills, and fatigue, throat ache, coughing, tiredness, and shortness of the breath are the main symptoms in humans. Now, skin lesions with the black issue characteristic of anthrax we can see in these pictures. Lesions in the animals, rigor mortis is absent, bloat and putrefaction are developed quickly, spleen is enlarged, blood is dark red and unclotted. Prolapse of the rectum is seen in the animals. In humans, the black issue that is in the cutaneous form often show as a large painless necrotic ulcer. It is as a beginning, it is as a irritating or itchy skin lesions or blister that is dark and usually concentrated as a black dots, somewhat resembling at a bread mold at the site of infection. It is resembling at a bread mold at the site of infection. Cutaneous anthrax infections normally do not cause pain. Nearby lymph node may become infected, reddened, swollen, and painful. A rare disease, human anthrax is the most common in Africa and Central and Southern Asia. When we're talking about the diagnosis, history of the sudden death and oozing of the blood from the natural orifice in the animal and the typical clinical sign in humans. In the microscopic examination of the blood films, that is when we stain the blood with the polychrome methylene blue, that we found the McFadden reaction. Culture examination on the sheep blood agar, we found the medusa head colonies. Animal inoculation in the guinea pig, and serological test, that is the Ascoli test. It is a precipitation test with showing the diagnostic tool for this disease. In Russian Federation, a skin test utilizing anthraxin T3, the first license is under the former Soviet Union in 1962, has become widely used for the retrospective diagnosis of the humans and animal anthraxes. Treatment with the antimicrobials is effective if administered at the early stage of the infections. Control measures include the correct disposal of the carcass, disinfection, and discontamination of the contaminated materials, and decontamination of the environments. Anthrax can be controlled largely by the annual vaccination of all grazing animals in the endemic area. At present, live anthrax spore vaccine prepared from the Bacillus anthracis strains suspended in the glycerin is available in India. In human, there is a vaccine that can help prevent anthrax, but however, this vaccine is not typically available for the general people. It is only recommended for the people who are at an increased risk of coming into the contact. Human anthrax vaccine are developed by the Soviet Union in the late 1930 commercially first time. The current FDA approved US vaccine was formulated in the 1960. Currently administered human vaccine include the acellular subunit vaccine is United States and live vaccine that is from the Russian varieties. Next disease is the brucellosis, also known as the Banks disease, contagious abortion, Malta fever, Mediterranean fever, and undulated fever. This disease is caused by the two bacteria, that is the Brucella melitensis and Brucella ovis. In goat, this is caused by the Brucella melitensis, and sheep, it is caused by the Brucella ovis. In cattle, it is caused by the Brucella abortus. It is a gram-negative cocobacilli. They are non-spore forming and non-motile bacteria. Animal transmission, eating and drinking contaminated feed, pastures and water, or breathing air that is contaminated with the brucella, milk, urine, semen, and fluid of the aborted pregnancies are the source of infection in animal. Cattle with the brucellosis can infect the goat and sheep. This is also reported. Human transmission, eating or drinking contaminated dairy products, breathing contaminated dust, direct contact of the open wound with the contaminated tissues, fluid, or the surface can infect the humans. Brucella melitensis infect in the certain breeds of the sheep causes the clinical signs in the disease similar to those in the goat. However, Brucella ovis produce a disease unique to sheep in which epididymitis and orchitis impair fertility are the key economic impact. That is the Brucella melitensis infect the both sheep and goat, but the Brucella ovis can infect the sheep only. When we're talking about the animal symptoms in goat, abortion, retained placentas, inflammation, testicular inflammation, fever, depression, weight loss, diarrhea are the main clinical signs. In extreme cases, brucellosis can cause arthritis in the joints. Primary manifestations of the brucellosis in sheep are the lesions of the epididymitis, tunica, and the testes in the ram, placentitis and abortion in ewes, and occasionally prenatal death in the lambs. In the human symptoms, it is known as the undulated fever in humans. The symptoms include intermediate fever, which sharply rise during the late afternoon or evening, accompanied with the chills, arthritis, liver damage, malaise, weight loss, and the miscarriage. Other symptoms are pain in the muscles, joint, back, swelling of the testicle and scrotum area, swelling of the heart, that is endocarditis, and neurological symptoms. It can be seen in up to the 5% of the cases. Diagnosis in the animals can be diagnosed through the Brucella milk ring test, plate agglutination test, complement fixation test, and ELISA test. In human, brucellosis can be diagnosed in the laboratory by finding bacteria in sample of the blood, bone marrow, or other bloody fluids. Microbiological diagnosis of the human brucellosis relies on the three different modalities, that is a culture of bacteria, serological test for the bacteria, and nucleic acid amplification test for the bacteria. Vaccination. As like in cattle, killed vaccine cannot prevent the brucellosis in sheep and goat. As a result, the attenuated strain of the Brucella melitensis, RAB1, is widely used for the prevention of the brucellosis in sheep and goats. It is injected subcutaneously or dropped into the conjunctiva of lamb and kids between the 3 to 5 months of the age. Conjunctival vaccination is considered safer than the subcutaneous injection. Brucella melitensis RAB1 vaccines like Brucella abortus S19 can infect human, so appropriate precautions should be taken against the needle stick injury. It should not be given to the pregnant animal because a full standard dose may cause abortion. There is no approved vaccine that prevents the human brucellosis. Next disease is the chlamydiosis, also known as the ovine chlamydiosis, an angiotic abortion of the Eve. The disease is caused by the Chlamydophila abortus, formerly known as the Chlamydia psittaci. That is the Chlamydia psittaci, it is gram-negative, obligate intracellular bacteria. Transmission, drinking contaminated feed, water or milk, breathing or contact with the contaminated vaginal fluids, placentas, and aborted fetus. In human transmission, contact with the infected pregnant Eves and does during the birthing process, postpartum vaginal secretion, contaminated beddings and wastes, uterine discharges, breathing contaminated dust, touching aborted fetus, fetal membrane, and placentas. Animal symptoms are the abortion during the last month of the pregnancy, with a small number of the abortion in the first year, followed by an increase in the second year in the herd. Stillborn or weak newborns that die within 2 days. Human in there is a no major symptoms, having a influenza-like signs with the headache, chills, fever, joint pains, light sensitivity, vomition, and sore throat. It is especially dangerous for the pregnant women that it can cause miscarriage. Diagnosis: the disease can be diagnosed on the basis of serological test, that is a complement fixation test, and isolation of the organism. When we're talking about the treatment for this, tetracycline are the antibiotic for choice for the therapeutic use in the chlamydiosis. Rifampin followed by the tetracycline and erythromycin recorded good results. Control and prevention: the live and inactivated vaccine prepared from the chick embryo yolk sac membrane are available in some countries. No effective human chlamydia vaccines are available. Next disease is the KCS lymphadenitis, also known as the ulcerative lymphadenitis and ulcerative cellulitis. Causes: Corynebacterium pseudotuberculosis, that is a pleomorphic, non-motile, non-spore forming, non-capsulated gram-positive rod bacteria. Contact with pus from the KCS lymphadenitis abscess, eating contaminated forays as a lambs and kids while nursing is cause transmission in the animals. In human transmission, direct skin contact with the pus of infected animals can cause the disease. Animal symptoms: the disease is sporadic in nature and develops slowly. External abscess behind the ears, beneath the jaw, neck, shoulder, rear flank regions, between the hind legs where the scrotal sac or udder, and there is a progressive weight loss in animals. Although the absent can be treated, an animal will remain infected for the life. In human symptoms, painful skin wounds with the pus and dead tissues. In control, in the treatment, antibiotic like penicillin and ampicillin may be used in the animals. Ulcer are to be treated with the antiseptic solution. In control and prevention, contaminated material should be disinfected, maintain good hygiene. No immunoprophylactic agent are available for this disease. Next one is a campylobacteriosis, that is a vibrio and also known as the epizootic abortion. This is caused by the Campylobacter fetus subspecies intestinalis and jejuni, formerly known as the vibrio fetus. High motile, non-capsulated, as-shaped, gram-negative rod bacteria. Campylobacter fetus need microaerobic condition, that is 5 to 10% carbon dioxide for its growth. Transmission: in animals, that is eating forage or drinking water that is contaminated by the infected placentas and aborted fetus. After the first abortion, the Eve is immune to the disease, but spread Campylobacter jejuni in the postures pain through the feces. Human transmission: eating or drinking contaminated food and water, handling infected female during the lambing, kidding, or handling aborted fetus and placentas. In animal symptoms, the main symptoms are Eve aborted during the last month of the pregnancy, stillbirth, and weak lamb. They die soon after the birth. Occasionally, Eve death due to the meningitis. Goat appear to be immune for this disease. Aborted or stillbirth fetus may have no lesions, or they may show subcutaneous serosanguinous edema, necrotic liver lesions, bronchopneumonia. Placental cotyledons are the enlarged, yellowish, and covered with the blood-tinged exudate, while the intracaudatory stroma is adenomatous. Human symptoms are the main symptoms is the enterocolitis, intestinal inflammation, and diarrhea. There is abdominal pain, fever, nausea, vomiting, and arthritis. Convulsions and meningitis is also seen in humans. Treatment azithromycin and ciprofloxacin are the commonly used for the treatment for both humans and animals. When we're talking about the control and prevention from this disease, a single injection of the vaccine containing disrupted formal killed Vibrio fetus war intestinales serotype V was shown to the good protection against the abortion. There is currently no Campylobacter vaccine available for use in humans. Next one is the Jones disease, also known as the paratuberculosis and chronic bacillary dysentery. This disease is caused due to the Microbacterium avium subspecies paratuberculosis. Small acid-fat bacilli, this is strictly aerobic, non-spore forming, non-motile, and gram-positive. When we're talking about the transmission in animals, contaminated pastures and drinking contaminated feed, water, and milk. Kids and lambs are more susceptible than adults. Cattle, sheep, and goats can infect each other. In human transmission, eating and drinking contaminated raw milk, uncooked meat, and unpasteurized dairy product can cause this disease. In animal symptoms, first signs may not appear until years after the onset of the infections. In sheep and goats, diarrhea is absent, but feces remain soft and there is emaciation and shedding of wools. Depression and dyspnea are noticed in the goat, but there are less in sheep. Signs include progressive loss of weight and condition despite of the good appetite. In human symptoms, diarrhea and weight loss. It is associated with a disease known as the Crohn's disease in humans. The signs include general malaise, abdominal pain, and diarrhea. It is a lifelong disease that has no cure. In humans, streptomycin sulfate, better for treatment, we can use. When we're talking about the control for this disease, vaccination with the Gerson vaccine, that is heat killed Microbacterium paratuberculosis in the mineral oil, has given excellent result. First Indian indigenous vaccine against Jones disease in goat was developed using most prevalent and highly pathogenic, that is the S5 strain of the Microbacterium avium subspecies paratuberculosis, genotypes as the Indian bison types. Next disease is the leptospirosis. Leptospirosis is also known as the Wells disease, canine typhus, sugar disease, rice feed worker disease, and sugarcane worker disease. This disease is caused by the Leptospira species. In sheep and goat, mainly Interogens and Leptospira common. That is a thin, tightly coiled, obligate aerobic spirochetes characterized by a unique flexion type of the mortality. Transmission in animals by contact with urine, body water, soil, forays, aborted fetus, and placentas of infected animals. Even after clinical recovery, may pass in the urine for a long time. Sheep do not appear to be the source for the infection for other species. The disease is more common in the area where climate is warm, humid, and soil are alkaline with the abundant of surface water. So human transmission, skin contact with the contaminated aborted fetus, placentas, fetal fluids, urine of the infected animals, and the contaminated water and soil. Contact through the scratched skin or cut in the mucous membrane, such as the eyes, nose, and mouth, or by the eating or drinking contaminated water or food. Outbreaks of the leptospirosis are usually seen during or after the floods. In the animal symptoms, the disease is not so much common in sheep and goats. Anemia, hemoglobinuria, and high fever may be seen in acute cases. Abortion, stillbirth, premature, or weak kids and lambs. Jaundice, reddish discoloration of the milk from the swollen teeth may also seen in the goat. In the human symptoms, infected humans may or may not be display the symptoms. Signs include the high fever, severe headache, chills, muscle ache, and the abdominal pain, vomiting, jaundice, diarrhea, rashes, meningitis, and the liver failure. It is diagnosed by the microscopic agglutination test, that is MATE. This is a widely acceptable test for the leptospirosis in the animal. It is suitable for the diagnosis. Streptomycin and penicillin are effective in the end. Other treatment should be symptomatic. When we're talking about the control and prevention, the control of the carrier rodent by the chemical means of is effective, is like zinc phosphide. Potassium permanganate can be used for the disinfectant of water. Vaccination are not so common in sheep and goat. Next disease is the listeriosis, also known as the circling disease and meningoencephalitis. This disease is caused due to the Listeria monocytogenes. It is a gram-positive motile non-spore forming and survive for the 3 degree to 45 degree Celsius temperature. Transmission, eating and drinking feed, water and soil that is contaminated with the Listeria monocytogenes by the birds, mammals and fish and aerosols. Cattle, sheep and goats can infect each other. Heavy silage feeding acts as a predisposing factor for this disease. In human transmission, eating, drinking contaminated raw milk, uncooked meat, and unpasteurized dairy product, handling aborted fetus, and placentas of the infected ewes and does can cause this disease. In the animal symptoms, in sheep and calf, the disease is more acute and death may occur within 3 to 4 days. Death of animal due to the respiratory failure. Depression, fever, decreased appetite, head pressing, reduced milk production, walking in circles, seizures, and facial paralysis seen in the animals. In sheep and goat, abortion occur from the 12th week onwards of the pregnancy, and after birth, placenta is retained. Zoonosis cycle between the human and the animal. In the human symptoms, diarrhea, premature childbirth, miscarriage, stillbirth, health problems in the babies, fever, malaria, headache, abdominal cramping, nausea and vomiting. It is also responsible for causing repeated abortion in women. Treatment is chlortetracycline is considered as a drug of choice for the treatment in cattle, but less effective in sheep. In human, most used treatment is intravenous ampicillin. Also may use gentamicin in the combination with ampicillin. When we're talking about the control and prevention from this disease, in some countries, killed vaccine available for sheep, but not so much effective. In human, currently no vaccine is available against the listeriotic infections. Therefore, the control and prevention of the infection depend upon the general hygiene and proper precautions during handling and the cooking of foods. Next is the important disease that is a Q fever, also known as the quinsand fever. It is caused due to the Coxella brunati. This is gram-negative rickettsial agent. Transmission, eating contaminated forage, tick bites, direct contact with the placentas, uterine fluids, milk that is infected with the Coxella brunati. In the human transmission, handling aborted fetus, placentas, and uterine secretion from the infected does and ewes. Contact with the infected animals. People at high risk are the working in the slaughterhouse, veterinarians, researchers, food processors, and sheep and cattle workers. Symptoms in animal. Infected animals show no symptoms of the disease until abortion. Some animals show depression and the lack of appetite 1 to 2 days before abortion. Severe placentitis, malaise, anorexia, infertility, and subclinical mastitis in animals. Q fever transmission, that is a direct transmission of via contaminated dust to the humans and through the contamination from the urine, feces, and the material can cause the disease in the humans. When we're talking about the human symptoms, flu-like symptoms as high fever, headache, muscle pain, confusion, sore throats, chills, sweats, non-productive cough, nausea, vomition, diarrhea. So in the control and prevention, it can be prevented by avoiding high density of the animal during kidding, lambing, and calving seasons. Carcasses, aborted fetus, and placentas should be properly removed to minimize spread from potentially infected materials. Pregnant, infected females should be isolated from the herd. Next disease is the sore mouth, also known as the ORF, scaby mouth, contagious ichthyma, and lip and leg disease. This disease is caused by the parapox virus of the family Poxviridae. This is a double-stranded DNA virus. Transmission in animals, that is through the contact with the infected animals or by the contact with infected tissue or saliva that is contains the virus. In the human transmission, direct contact with an infected animal's skin, hair, or contaminated surfaces such as the clothing, brushes, and clippers. Animal symptoms include elevation of the skin that can progress to blisters that encrust on the lips, mouth, face, ears, vulva, scrotum, teats, feet, and mammary glands. Extension of the erosion in the buccal cavity and respiratory tract may cause the gastroenteritis and pneumonia. Recovered animals are immune for more than 2 years, but the antibodies do not pass through the colostrum. And newborn of the immune dams are quite susceptible from this disease. These are the human symptoms, the painful sores on the hand that may last for the 2 months in the humans. Next disease is the vesicular stomatitis, also known as the pseudo-FMD, sporadic ephta, and mouth rust. This disease is caused by the vesicular virus, that is the rhabdovirus family. Transmission, that is in the animals through the insect bites, contact with the saliva of sick animals, pus draining from open blisters, and aerosols, coughing and sneezing, and direct contact. When we're talking about the human transmission, handling with the infected animals, contact with saliva and fluid draining from the ruptured blisters. Animal symptoms are the blisters on the tongue, teats, and inner lining of the mouth. Ulceration of the oral mucosa in cattle, swine, and horses are the main signs, but both goats and sheep may also be infected with the causative virus. Natural clinical disease is rare, mortality is null, but this disease is misdiagnosed with the FMD. Human symptoms like the flu-like symptoms, headache, fever, and the muscle ache. Next disease is the Rift Valley fever. This caused due to the Rift Valley fever virus of the Bunyaviridi family. It is transmission through the mosquito, coughing, and sneezing. In the human transmission, mosquitoes, direct contact with the infected animals, coughing, and sneezing. Animal symptoms are fever, dullness, lack of appetite, abortion, vomition, bloody diarrhea, unsteady gait, skin necrosis on udder and scrotum, and later on death. Ocular disease as mild symptoms are also noticed in animals. In human symptoms, mild fever, weakness, which can progress into the brain inflammations, liver abnormalities, headaches, seizures, extreme weight loss, vision loss, and back pain in humans. Next disease is the ringworm. Ringworm is widely spread among the animals and humans, also known as the dermatophytosis. It is caused by the main 3 fungal agents, that is the microsporum, trichophyton, and epidermophyton. Epidermophyton are especially in the humans, but in the animals, microsporum and trichophyton are the main fungal agents. In sheep, trichophyton mucosum, trichophyton bentographites, trichophyton rubrum, trichophyton cuniculum, trichophyton villosum, and microsporum gypsum are the main causative agents. In goat, Trichophyton verrucosum and Microsporum gracin and the Microsporum canis are the main causative agents. When we're talking about the transmission in animals, contact with the infected herd mats and pain mats at show and cells introduced by the contaminated clothing and supplies of the farm visitors can cause this disease. In the human transmission, direct contact with an infected animal's skin or hair or contaminated surfaces such as the clothing, brushes, and clippers can cause this disease. When we're talking about the symptoms in animals, there is a ring-shaped, crust is scary, circular patches that may or may not be pruritus, itchy on the skins where there is hair or wool less. It is not recorded very frequently. The lesions are usually seen on the face and head and affect the hairy rather than the woolen area and are typically allopathic and the crust. Ringworm in goats, lesions affect usually ears, head and neck, but all the body parts may also be involved and lesions resembles as those of the cattle. So the next disease is echinococcus, that is hydatidis and hydatid disease. The causative agent, that is the larva stage of the tapeworm, Echinococcus granulosus. Transmission in animals, eggs are present in the host feces. The eggs are ingested through the contaminated feed. In the human transmission, humans are infected through the ingestion of the parasitic eggs in the contaminated food, water, or soil. Symptoms in humans, abdominal pain, nausea, and vomition are commonly seen when hydatitis occurs in the liver. If the lungs is affected, clinical signs include the chronic cough, chest pain, and the shortness of the breath. Other signs depends on the location of the hydatitis and the pressure extended on the surrounding tissues. Non-specific signs include anorexia, weight loss, and weakness. Treatment includes surgery to remove or drain cyst or liver resection and use of the long-term chemotherapy for the parasitis. Now, some steps that can minimize the risk of this zoonotic diseases that can spread between the humans and sheep and goat. First, we have to keep sheep and goat healthy and practice good sanitization and hygiene at the farm. Vaccinate sheep and goat for the non-zoonotic diseases such as the anthrax, rabies, and brucellosis if they are present in the endemic areas. Wear personal protective equipment where possible and cover any wound with watertight dressing when handling to the sheep and goat. To protect against mosquito and other biting insect that can transmit disease, cover up with a loose fitting long sleeve shirts and long pants and apply mosquito repellent to expose skin. Ensure to understand the signs of the common zoonotic diseases and what to do if have contacted ones. Not to eat raw or semi-cooked meat of the sheep and goat. Not to drink unpasteurized milk of sheep and goat to save from these diseases. These are the approaches for prevention and control for zoonotic diseases in general. First one is a quarantine. That is, if we are entering adding the new one into our heart, first we follow the quarantine rules. Then the test and slaughter policy we have to apply in diseases where there is a no cure. Environmental hygiene, mass immunization, vector control is very important. Reservoir control, early diagnosis of the disease can prevent from the disease and prevent from the spread of the diseases to the other animals and humans. Mass treatment is beneficial. Genetic improvement in terms of the breed improvement. Health education is the key concern for this aspect, as the people with more educate about the zoonotic diseases, they will apply or follow the procedures so they can reduce the risk of these zoonotic diseases. An epidemiological diagnosis, if the disease is prevalent in the particular area, then the epidemiological diagnosis to diagnose the disease as early so we can control this disease as early as possible. Thank you.